Together we achieve victory over heart failure.
Hello and namaste. I am Dr. Varun Sibal. I'm a chief interventional cardiologist working at Bhavnagar. And today we are delving into a silent epidemic that India is combating, and it is heart failure. In India, the majority of patients grappling with heart failure are surprisingly young individuals. It's a common occurrence in to witness young adults seeking medical assistance for heart failure. Unlike the Western countries, where heart failure is predominantly a disease of the elderly. Let's break down 5 essential insights on heart failure. Number one, firstly, what does it mean when a doctor tells you that you have heart failure? When people get a diagnosis of heart failure, they think it's the end of their lives. The term heart failure can seem frightening, but it simply means your heart is struggling to pump blood as efficiently as it should. The ejection fraction, or EF as it is called, measures how well your heart pumps blood. It is the amount of blood pumped out of your heart's lower chambers, which is known as ventricles, each time it contracts. While a normal ejection fraction is around 50 to 70%, individuals with heart failure typically have an ejection fraction below 50%, or to be more precise, less than 40% or lower. Secondly, why are so many Indians affected by heart failure? Well, the reason is genetics. They play a significant role. Indians are genetically more vulnerable to cardiovascular diseases. Furthermore, hypertension, diabetes, obesity, and smoking habits worsen this epidemic. Number three, moving on. What are the signs and symptoms of heart failure? So, kindly watch out for confusion, fatigue, heart palpitations, nausea, shortness of breath, and weakness. And also, if there is any loss of appetite or vomiting. Number four, how can we protect ourselves from this disease? To be honest, our hearts work incredibly hard to keep us alive. These are the 5 golden rules which we can follow to return the favor. Number one, early detection of heart failure through regular blood test. Number two, dietary adjustments to maintain heart health. Number three, incorporating daily exercise into your routine. Number four, practicing stress management techniques. And number five, quitting alcohol, tobacco, and smoking. Lastly, coming on to the fifth point, what comes next after heart failure diagnosis? Thankfully, medical science offers numerous treatment options. It is possible to lead an enjoyable, meaningful, and productive life. Heart failure medications improve quality of life and longevity. Devices like biventricular pacemaker, implantable cardioverter defibrillator, and heart valve repair or replacement. And the last resort treatment option is heart transplant. The lifetime risk of congestive heart failure is 1 in 5 for both men and women. Remember, awareness and proactive measures are key in combating this silent epidemic. Thank you.